memorize it.
I like to do it.
Who is that?
I just use that. Do
They come to her, and then she should. Then my job that day is to reach out.
And we can actually slide. We can actually get one more.
Yeah.
Here if we need to.
Here's what they're doing, and things are fine, and it was creepy.
Now? Yeah, I mean, that's fine.
Hey, how you doing today? Good. Yeah, I'm back in this little bitty one here.
Is that right? Well, we missed each other.
We started at the 7th.
I was like, looking for you.
Since we were parked over there, we just kind of
I don't want to know.
so we could get out the traffic. But everybody was so I think everybody, all the things, let's go. But I'm like, Lord, it's making me feel great.
Silent band. I was working and my mother called me. You guys need to find a TV somewhere. I remember where I was.
Visiting with them. Sitting at the light, Saturday a week ago.
Yeah, right. Yeah, sure. In her window, and she said, I don't think so.
So important to the idea of you, like, saying, high school 20 years, it's really
High school. There you go.
I'm willing to give it up.
How are you?
Yeah, take your suggestion. Do what? Take your suggestion. Put another chair. Okay. There's plenty of room.
You mean to?
Yeah. Keep these mics so when I'm crunching these chips here, it doesn't show.
And on top of that, they think on top of that, deficit is going
Gotta mute my mic so I didn't show loud, can't hear anything. Uh-oh, what is this here? I was reading an article on 10 ways to tell if you have adult ADHD. I don't have it because one of them was forgetting to eat. That's not going to be my problem.
Mine either.
I might grab me some later on. I'm not sure.
You know that, right?
Yes, I know. Thank you.
I guess I'm going to open it up and see. It's good.
What a salad is there? There is a salad.
Names in the boxes, or they just are all the boxes the same over there?
No, there's a chicken pesto, and there's roast beef, cheddar cheese. What do you want? Number one food.
Chicken pesto is with pasta, or is it just
It's a sandwich.
sandwich? Okay, I'll take the chicken pesto. Thank you.
Told the judge I was reading an article on 10 ways to tell if you have adult ADHD. One of them was forgetting to eat. I'm pretty sure I don't have it.
Yeah, that's fine. Thank you.
Boy, Will, I can't talk. That bridge blew out.
A lot of water.
He watered all over it.
Yeah. It was already on the list.
Yeah. Definitely is now.
Yeah, we got lucky. We didn't have any damage. He said, Chisholm? I said, yeah. He goes, don't know where it's at, but it's not here anymore.
Not good. Wonder how many people on the river lost boats, ATVs, they parked too close. Bunch of stuff.
We mess downstream.
Yeah. Dustin, does Ryan want to eat? Deidre and all them? How's it going? Wish you'd help me with that bill.
Oh, yeah. Did you have to pay for all that?
Yep.
That was the last thing I told Perry on the phone. I said, don't let the dad get away without paying for the bill.
Big win.
Yeah.
Did you get over there, Will?
No, I didn't go. I saw Scott at Brazos Landing Friday night. So where did they have their watch party at? Or I saw a picture.
Too.
Oh, okay.
He and Jim kind of had the same room.
I know, right?
Have a lot of people.
Coming and going, yeah, I mean, it wasn't bad at all. A little shocked that a couple of bonded.
Yeah.
Surprised me a little bit.
I'm surprised Conley's failed again.
Golly. It's 3 times. 3 times. I was surprised Lorena's failed.
I was too.
As much as it did, really.
Why do you think it failed?
I think we already had a pretty good little tax rate.
Yeah.
And I think that, what is it, 20, what was it going to be, 23, 28 cents, that down to 100? Pretty high. I don't think it's vote against the administration or something. I don't know if there's any problems. You don't ever know.
So, guy, I guess he's one of the board members that finally wrote this long post last night or this morning. He said the amazing thing is the majority of the road, he said by far the majority of the voters are over 65.
Oh, yeah.
And wouldn't affect it. And I think that's the fact they didn't know.
I'll tell you who I think runs up. Always seems to have her stuff together. Sharon Shields.
Dude,
Sharon
yeah.
Shields. That thing passed. She always seems to have her ducks so lined up and so organized.
Well, they got.
Yeah. They passed a pretty good one.
92 million.
Yeah.
Yeah. The two biggest ones passed.
Gatesville,
Gregor and
McGregor, 86 million.
yeah, it was big.
Did you see that the city of Dallas passed $1.5 billion bond? Big with a B.
With a B.
With a B.
DISD did that a few years back. $1 billion on a school bond.
Somebody else had a $650 million one that passed.
Howdy.
The kind of bond you want to pass is where you can tell if it's not going to cost them anymore.
Yeah.
Doesn't change the tax rate.
No brainer.
We kind of did a flushing and over there as well.
Oh, they did? Did they get rid of all the?
Well, the
Jennifer, get you a sandwich.
came in last time that are creating all the havoc.
Uh-huh.
They don't run until next time. But they got behind two candidates and pushed them, and they had their signs all looking the same way. Both of them got hammered, 1,000 to 400.
Oh, really?
Yeah.
Where?
Woodway City Council.
Oh, Ken. Sorry.
He did well.
He really did well, didn't he? And I like Ken. He's a good guy.
What'd she do?
He used to be Waco Trip.
Yeah, Waco Trib. Is he retired now, or?
So he had that neighborhood edition for so many years. When they used to put up that little supplement, he was over that.
Oh, his Trib's so sad now.
I haven't read an article from there in I don't know how long.
I read
I swear,
the digital.
Mike Copeland cut and paste that article about Precinct 2 yesterday, Sunday.
He didn't put what I said in there. He put most of it, but some of it didn't.
That was pretty good.
That's Andrew.
Who's on?
I think they are. Mike's on. You're muted. On mute.
Keep them that way.
How you doing? How are you? Good to see you.
We'll make it happen.
Yeah, go grab something to drink and lunch, sir.
Oh,
Wave Dylan up this way.
Dylan here?
Yeah.
There you go. Duck? You mean that lame duck?
Yep, he's there.
like, did you see it was like the movie.
Have you seen the pictures of Ridgewood? Ridgewood.
Yes. Yes, I got the, email later.
Mayor.
Well, what's that?
See you. All done.
Cody making some peanut butter and jelly. Hey, what's going on?
How you doing, buddy?
How's it going, guys?
I told him Saturday night, we're providing lunch. I said, Cody's probably started on the peanut butter and jelly sandwiches.
Already started. Stale bread.
Their spring event.
Sorry for the circumstances, but
Yeah.
glad to get down
I
there
told
and eat
them, I said, I'm sorry, I can't. We,
celebration.
yeah.
I've never been to this
That
place.
went
You been?
just like I thought it would.
Yeah.
I'm actually surprised at the number of people that voted. Didn't
I was reading an article on Munster, Texas.
I think it's someone
Having a huge battle up there.
you
Have a beer sales.
you're in this role long enough to piss some people off, I guess.
Divided the city.
Like, Mayor-elect. I like that.
I mean, you know, I give people their titles. Look at here.
Mayor-elect.
Okay.
Between bands, I gotta keep
Okay.
Birthday boy.
You don't want to sit over here?
I mean, apparently somebody heard something.
He looked and saw where he had to
Somebody
sit.
said,
It was just that he looked over here and it was like, I don't know about that.
Judge, is the hat rack reserved for county officials?
we will let anyone with hair.
Okay, all right.
Tip yourself.
Be surprised how many hats we haven't lost that are found.
Congratulations.
I guess our condolences won.
Yeah.
Anywhere else?
I was, already did. Will.
Shake your hand. I think you're
His concessions.
Yeah, they don't generally. I'm just making sure I'm not breaking through trouble.
Testing.
Yes. Great.
Anybody that does not have a sandwich and want one, get it. I don't think they can hear me.
It's not on.
Not my budget.
No. And I mean, so you have to, I can just sit back
What am I doing?
and be an observer.
Observer. And
Green light on?
why is that in there? And I don't know
I
why.
don't think we manage that anymore. right, if anyone that does not have a sandwich and wants one, there's more up there. Drinks and some chips, so help yourself.
Recording in progress.
All right. Good day, everyone. Let's call the meeting to order. This is Monday, May 6th. Had to find it there. May 2024. It is 11:49 a.m. Proof of posting, please.
The agenda was posted on Friday, May 3rd, 2024 at 8:15 a.m.
All right, thank you. At this time, let's stand briefly for a pledge to the flags, and then we'll, for a moment of silence, and then a pledge to the flag. Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands,
one nation, under God, indivisible, with liberty and justice for all.
Pledge the Texas flag. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Okay. And I don't think there's anyone here that, but if there is anyone who wants to speak to the, does the city need to call their? Yeah, I'm sorry.
I'll call a meeting in the Waco City Council to order at 11:51 a.m.
All right, thank you. If there's anyone here to speak to these groups on public issues, please come forward. If not, we will go to discussions or actions on consider and approve the February 26, 2024 summary notes. Anybody had a chance to review those? Not, I'll entertain a motion to approve.
So moved.
Have a motion and second. Any other discussion? No other discussion. All in favor say aye. Aye. Opposed, pass. All right, next is discussion of current and future healthcare infrastructure, economic projections, and healthcare needs, and including a proposed study by the Partnership for the Accessible Care and Economic Sustainability, AKA PACE, work group. So at this time, presenters just come forward. There's 3 spots, and we can put some other chairs up there as well.
Okay. And what I'll do, Jackson and I can talk here first, and then I'll let someone take the 3 y'all can after I'm done. So I'm just introducing. Good afternoon, everyone. I'm Ashley Allison. I'm the Executive Director of Waco Foundation, and I'm happy to be here presenting with some of our colleagues today. I hope you've all had a chance to read the memo about the Community Partnership for Accessible Care and Economic Sustainability, which we'll call PACES from this point forward. I'm here with several of my community and healthcare leadership colleagues to bring awareness to a significant issue and offer a solution for the first phase of work that is needed to begin addressing healthcare concerns. I know it doesn't come as a surprise to anyone in here that the current state of health and wellness care in Waco and McLennan County is insufficient to adequately meet the needs of our population. PACES members, through this project, will initiate a set of research and analysis to fully understand the current healthcare system, establish projections for future needs, develop cost models, and propose avenues for long-term financing structures to sustainably support healthcare in McLennan County. The financial investment into this type of study is similar to studies that were done for Lake Waco. And if you want to think about the resource of Lake Waco and water, which we all enjoy now due to previous planning and projections about usage and needs for that resource, we liken this study to healthcare like the study of Waco's water. As the Executive Director for Waco Foundation, I'm pleased to share that Waco Foundation is willing to serve as the fiscal agent for the study, which means we would accept funds and administer them and report on them, and we would hire the consultants that would work with the PACES group in order to complete the studies. And I'll turn it over to Jackson Griggs to give a little more background, and I'm going to excuse myself and invite the other three speakers.
So it's good to see you all again. Jackson Griggs, I'm a family doctor and the CEO of Waco Family Medicine. I've been in Waco for 21 years, and actually my role at Waco Family Medicine is derivative from the commitment that I have to our population and its health. And this conversation is similarly derivative from a commitment that I think we all share to see our community thrive. And with that, as Ashley mentioned, our community is unable to meet current healthcare needs, and the situation will devolve from here. County health rankings show that McLennan County premature death, that's death before 75 years old, is 15% higher than the overall state of Texas. We have more babies born that are low birth weight. We have more smoking and obesity. And McLennan County has more frequent poor physical health and poor mental health days than the average in the state of Texas in the United States. There are wide disparities in health status, disease prevalence, and mortality among Texans. A recent study commissioned by Episcopal Health Foundation found that by 2030, McLennan County is on track to spend over $24 million per year in excess healthcare costs because of the impact of health disparities. In other words, if we continue to operate like we are now without sufficient infrastructure to ensure that every person in our community receives the preventive care they need, Waco and McLennan County is on the hook for $24 million per year. In addition, the loss of productivity due to health disparities is estimated at $35.5 million annually. So in this period of time when we're really focused on economic development and capitalizing on the population growth that is in this Golden Triangle in Texas, this just punches us right in the gut. I mentioned premature death as this is measured in life years lost before 75 years old. It's nearly 4,000 every year for our county. So life years lost before 75 years old. And conservative estimates suggest that the economic value of life lost approaches $200 million annually. $200 million annually because of that premature death. It's an astounding impact. And so as our community grows, we just simply can't afford to continue our current healthcare trajectory. Fully understanding our healthcare infrastructure, determining where we can make prudent investments to serve our population is critical if we're to ensure the future vitality of Waco and McLennan County. Not addressing this issue now will pose a substantial human cost and a significant economic burden to our future. I'm worried we will soon approach a situation where hospitals, clinics, and healthcare organizations will be forced to reduce or discontinue services in order to stay operational. Across the community, we've already seen longer wait times for access to care, and for some needs, there's no care available for large portions of the community. These are all the early warning signs of a future that is going to look bleaker if we don't take action in terms of analyzing the problem and problem solving for our entire community. And with that, I'd like to turn it over to Daniel Thompson with the Heart of Texas Behavioral Health Network to share a little bit about what he is seeing.
Good morning, and thank you for giving me a couple of minutes to talk to you about this important topic. As you know, I'm Daniel Thompson. I'm the CEO of the Heart of Texas Behavioral Health Network. I haven't been here 21 years, but I got here pretty darn quick. I've been here roughly 5 years now, and prior to my life as a CEO, I was a regulator for the state of Texas and worked in Austin worked for that system for 37 years. So I have been involved in behavioral health the majority of my life, as many of you know. My father was diagnosed as schizophrenic when I was 6 years old. And so I grew up in this public behavioral health system. And it is, in Texas, is woefully underfunded, but it is the best system we have in Texas because it's the only system we have. And so what the state does not fund comes back home to us. And that's where we are faced with some critical situations. And I want to really reiterate the points that Jackson and Ashley have made, that behavioral health is a key component to the overall well-being of not only individuals, but our community as a whole. And we know we're faced with some very critical shortages. For example, I've often, and y'all have heard me say that in Texas, there are only 2,500 public beds. None of those are here. The closest we have is Austin State Hospital, and we compete against 10 other Texas community centers for those beds. When I was a regulator, my last year as a regulator, I penalized Austin Travis County $1.5 million 2 years in a row for overutilizing that system. Overutilizing a system. Now think about that for a minute. You're penalizing local community centers for utilizing the limited resources we have in the state of Texas. What do we do in a scenario like that? Well, we inundate our partners like DePaul or the emergency departments, or we leave those folks to figure it out on their own. Entities like my own and Jackson's and Chris and Philip are all left to try and figure out this problem because the state is obviously not going to fund it at the level that we need. Since DePaul closed in December, and for the last 6 months, ending this morning, we have provided, and these are distinct cases just for McLennan County, 127,000 services since September. That's an increase of 95,000 over the prior 6 months. That doesn't factor into DePaul as being a root cause of that increase. It factors that that is an added burden to an already overburdened system. And so it's going to be up to us to figure out how do we care for our population. And that's where we need your help with this study. We don't know how we're going to do it, but we're going to figure it out. And I'm very confident in the partnership and my colleagues that are here beside me and behind me that we have that capacity to figure this out so that we can help save cost, we can help save lives, and we can reduce that burden locally as well as statewide. Because this problem is not just ours, it is a statewide problem. And we've got to look for these long-term sustainable resources. And we've got to figure out where those are here at home. So we feel like taking this study would be the first and very important step in helping us figure this out and you being a partner in those processes. I'd turn it over to Chris and Philip.
Go ahead. Alphabetic order.
No, go ahead. Is this on? Can you hear me? As you've heard so eloquently from my colleagues previously, I just wanted to reiterate some of the concerns that do force our community to look at the future with concern. Like you heard, many communities across Texas are facing challenges in providing essential health care to their individuals and families. We've already heard about the DePaul closure and know very well what that has meant to this community, but it's not stopping there. The healthcare environment is continuing to become more competitive for increasingly limited resources. The number of expected retirements of nurses and physicians, combined with the limited number of individuals looking to enter into the profession, will further create restrictions across Texas and our nation. We as community leaders, I look at all of us in this room that way, need to address the insufficient healthcare structure to meet the long-term community needs here in McLennan County. To neglect the healthcare issues today, as we heard, will lead to more costly and widespread problems in the future, impacting our quality of life and economic productivity. Without action, healthcare organizations will, as you heard, might have to look at reducing further services and or not be able to keep up with the growth to meet the future needs here in our community, which will affect patients and the long-term health of our community. Currently, we are at a significant disadvantage here in McLennan County. We are one of the largest and one of the poorest counties without a dedicated source of community funding. As costs continue to rise through the competition of the limited resources, healthcare organizations will be further constrained to meet the growth and the scope of necessary services for our community when competing with surrounding communities for those resources. I believe that this is a comprehensive analysis and is crucial to the development of a sustainable healthcare infrastructure for our community. PACES is a collaborative effort, as you heard. We are working towards an efficient healthcare system tailored to meet our community's unique needs. So thank you for listening.
And just quickly, I'll just mention Chris Lancaster. I'm the president for Baylor Scott and White Hillcrest. Just been back in Waco for about 4 months or so. And so what I tell you from my standpoint, just being here, is it really is a national question, and none of us know the future of healthcare other than the things that have already been mentioned, where it just kind of seems like an unsustainable model. I think I appreciate just being back here 4 months, the support in this group that's been meeting monthly since I've been here. Just shows the commitment and collaboration we have. So appreciate the consideration of the funding here. That'll allow us to be even more organized with our efforts, and I think we'd be willing to take any questions.
So I outlined the request, Waco Foundation would put up, won't you go back over that, what part we participate financially in, or Jackson, you may know.
So the ask is for $50,000 from the county and $50,000 from the city. The Episcopal Health Foundation has pledged $75,000 contingent on city and county participation. And with that collective corpus of $175,000, we can do a thorough analysis of the healthcare ecosystem, the delivery system, and a thorough economic analysis modeling for our current situation and for the future.
Who will do the analysis and the study?
So we've had in-depth conversations with Design Run consulting firm that is one of the principals is Patricia Young Brown. She's been a healthcare leader in Central Texas and for decades actually, and has supervised this kind of analysis for other communities. She will be the kind of quarterback of the team and there will be some additional consultants that she'll bring in to do more detailed analysis around expertise areas. And the economists we're looking at are those who have the capacity to do thorough healthcare economics for communities our size, who have a long list of successes in modeling out for healthcare costs and future casting built based on high-quality economic modeling.
What is the timeline for the study, and then once completed, will that information then just, foster some thoughts that you all have already had, or is it going to create a new strategy, or what are we anticipating?
Great question, Councilmember. We're looking at a analysis and discovery phase with an anticipation for a planning phase where discussions are able to take place based on the data that we've collected and thorough analysis. So this is what the funding that we're requesting is purely for the analysis discovery data phase, with an expectation that will be the kind of groundwork for the problem solving that will occur.
And the timeline?
Oh, I'm sorry. So we will. Our hope is to start June 1st, and then the discovery phase is 6 to 9 months, and then probably within that time frame, 9 months to a year, we'll be able to begin our problem solving.
Thank you.
How comprehensive is the study? Is this going to cover every phase of medicine, or is it more siloed towards mental health care? Or?
Great question. I don't need to answer all the questions. Anyone else can jump in here, but this is so there is a diminishing returns once you get into super subspecialty areas that are niche and kind of peripheral. What we're looking at is where the bulk of the cost and health is provided across the community. So, and in that respect, it will be comprehensive from the standpoint of both hospitals, the FQHC, Waco Family Medicine, the local mental health authority, Heart of Texas Behavioral Health Network are all at the table actively having these conversations. And we will bring others in as well based on the instruction of the consultant. Any other comments?
And the consultant is familiar with not only behavioral health and public health, but also the hospital scenarios.
Okay, fantastic.
Just to follow on to Commissioner Perry's question, the scope, I would hope, would have some data that we can look at, kind of sources and uses, our current, or maybe needs first, but then and how those funding needs are met currently, and then really what are current uses of those funds? Because I know there's no real organization of it all. It's a little bit hodgepodge, which is why we're undergoing this whole study. But yeah, I would hope that we could really define what sources or how much, what is the pile of money that we need to have a good healthcare system in Waco and McLennan County. Because that then gives to me some idea of what synergisms can we create between the parties that you just mentioned, Jackson, and the city and the hospitals and Waco Family Medicine and everybody else, just in order to me, that's going to be the gist of how I'm going to say, yeah, I'm on board with this whole concept of
Absolutely, and I've heard you in what you just shared. I heard we need to identify where gaps are. We need to build more efficiencies in our system, and we need to identify what's needed and how do we achieve what's needed in terms of resource allotment. If the statistics that I was sharing and the dollar cost of lost productivity and additional healthcare costs are true, well, if we can build a better system in our community, then some of those costs that right now are kind of in the, we're feeling them collectively across the community, feeling them in our bones because they're sagging. I think constantly about how there's no such thing as uncompensated care. All care is compensated. You can compensate it early on in a preventive manner, or you can wait until folks are very, very sick and they end up having high-cost care. They may be uninsured, but somebody's paying that bill, right? And then what happens is that bill gets distributed in insurance premiums that fall on the back of small business employers. So, I mean, we're feeling the impact, and if we can get, if we can be sophisticated about this and invest in upstream, high-value care, then some of this very expensive care that's occurring in folks who are uninsured can be remedied.
Thanks.
What, if any, role will the public health district have in this study?
I think I was on the board of the health district for a number of years. I chaired the health district and worked very closely. The health district is a vital resource in our community, and I see the role of the health district being very, very important. They have a tremendous amount of data. They have done excellent health needs assessments through the years. There's great talent from an epidemiologic standpoint and an education standpoint within the health district, and so I see them being very valuable partners in this.
The hospital, would the consultant be able to kind of help us with what it's not going to be able to be a hospital district, but a health care district? Would they be able to help us see what that looks like, help us, make any decisions if we do want to go to the voters as far as that goes?
When a patient comes in who's got abdominal pain to the clinic, I see that patient, and when I first start taking a history, I don't know if their abdominal pain is cancer, or if it is gastroenteritis, or if it's Crohn's disease, or irritable bowel syndrome, or just a little virus that's passing. And so I've got to get a lot of data before I can determine treatment plan. And I think that's analogous to kind of where we are right now. We have the symptoms, and we need to do the data analysis to see what the treatment plan is. I think that is one of an array of future possibilities, and I think we need to be aware of that. And I think that the consultants that we're looking at right now have capacity to give us the information to make that and related decisions as well.
Other questions? Nope. And Dustin, from the county standpoint, for our ARPA funds available, would those qualify?
Yes, sir. So anything that goes to the efficacy of public health, be it a study, consultants, those do qualify. And then we can look to local foundation as the beneficiary or sub-recipient of that agreement.
Okay. Other questions?
Just appreciate you guys and the spirit of collaboration that you bring to the community.
Absolutely.
Thank you.
All right. Thank y'all very much. All right. Are there future agenda items that we want to that we know right now that we'd want to add to our next city-county meeting? Y'all think of?
I would like to see road planning added to the agenda, and maybe have Dr. Kumar come.
Oh, for MPO information?
MPO information, things like that.
Yeah.
On future road we're starting a new initiative through the MPO as far as putting new projects into the MTP, and so I think it would be good to hear about those and things like that.
Good.
Agreed, yeah. I think that's a great idea.
So like, do we also want to allocate some new time for orientation for new new mayors?
Do we have a couple, 3 hours to do that? I'm a slow learner.
Well, congratulations.
Thanks, Judge.
That brings me to my point. I have a lot of things for future agenda items.
Meeting adjourned.
And this is a good opportunity for this group to express to Dylan how much we appreciate his involvement and his leadership, and a lot of good experiences working with each other. We've had a lot of fun too, right? Right?
That's right.
Yeah, Andy's one of you did.
I think I got a lot of good stuff done, and it's been a real joy to get to work with each of you guys. So looking forward to seeing what y'all continue to do in the future.
Well, this is just one other thing that the city and the county enjoy together, is working on projects like this and other things. And, you know, we're kind of, from economic development, we're kind of joined at the hip, and I don't think there's any question that the discussion today does affect economic development. And there's a lot of ways to try to handle these issues and to have third-party experts to come in and say, this is the most efficient way to address it. I think we're going to learn a lot from it. All right, anything else to come before the group? If not, it is 12:21, we stand adjourned.
We'll adjourn our city council meeting at the same time.
There's still some sandwiches over there. Some of y'all didn't eat. Got yourself to sandwiches.
Judge, he mentioned the fact that increasing the deaths below age 71. I'm thinking, I'm glad I'm helping raise that.
You and I are both working.
That's right. We're talking about the average. We're working on that.
So we're running the